It is 8:10, 10 minutes right now past 8 o'clock. And Helen, good morning.
Hey, Al, how are you? And it's good to see you. I'm glad you're back here.
Well, thanks.
And you look great. You look healthy, and I'm glad to see you again. So you're listening to Common Sense Matters, and I'm going to be interviewing Dr. Jason Martin. He's coming to Winchester today. So if you are free at 1:30, he's going to be at the Annex. This is part of a tour he's making. He's running for governor, and this is a tour he's making of all counties in Tennessee. He's hitting every single one of them, and so Franklin County's getting him today. So we're going to be at the Annex today at 1:30 if you would like to meet him in person. Before we start talking to Dr. Martin, I wanted to just make a few announcements. But basically just that he'll be at the Annex today at 1:30. We're going to have food and everything. The monthly Franklin County Democratic meeting is going to be on Thursday, October 21st, also at the Annex, but in the small meeting room. We meet at 6 o'clock on Thursday, October 21st at the Annex. This is just our monthly meeting where we plan and things like that. They're having an event for Halloween on the square on October 30th. And we will be at that giving out candy. And on that same day, October 30th, the Tennessee Democratic Party is having their big annual fundraiser. It's called the 3-Star Dinner, and it's going to be at the Renaissance Hotel in Nashville. Now, tickets are a bit steep. It's $150 each, but that is their one big kind of gala fundraiser that they have for the whole year. So, let us know if you are interested in any of those events. You can look us up online, Franklin County, Tennessee, DemocraticParty.com. Franklin County, Tennessee, DemocraticParty.com. And we would love to hear from you. All right. And before we start our interview with Dr. Martin, I just, while I'm on the air, I wanted to dispel a rumor that someone had told my husband that they heard that part of Biden's big infrastructure bill was going to be paid for by a $2,600 tax per head of cattle. Now, this is absolutely... Al's looking around like, say what? This is a total falsehood. As soon as my husband told me he heard that, I went online, I fact-checked it. Every single fact checker, USA Today, they all say that it is not true. They are not going to tax every farmer $2,600 per head of cattle, because that would put every farmer in the country out of business. We have cattle, and we get the USDA little email thing every day in our inbox. I've never seen one mention of that. You would think if that were happening that would be all over the place. Anyway, just people, please check your sources, and if one or two sources say that something is true and 35 others say that it's not true, then I would assume that it's not true. Anyway, so just putting this out there, there is not going to be a cattle tax of $2,600 per cattle. Anyway, all right. Now, hi, Dr. Martin. I'm sure you didn't want to have to listen to all that.
It's okay. Good morning. Thanks for having me on there.
Yeah. So you are running for governor, right?
That's right. Yes, I'm a critical care doctor. I've been in Tennessee for about 20 years, and have never been a super political guy in the past. But I tell you what, Governor Bill Lee's complete mismanagement of the COVID crisis and all that's come with it, all the death, the school closures, the business closures, I think we could have done better, and that's what brought me to the fight.
Great. Where are you a doctor? Which hospital are you at?
Yeah, so I'm a critical care doctor. I work just on in the ICUs, only in the hospital, and I work in Sumner County at the two big hospitals up there.
Okay, wonderful. Well, so tell us a little bit about your background. Where did you grow up? Where did you go to school? Your family, your work history? Just give us a little bio about you.
Sure, absolutely. So first of all, I am married to Jennifer Martin, and Jennifer's a dermatologist here in Middle Tennessee. She is the smart one, believe me. I'm also a girl dad. I'm dad to Lily, who's 14, Ansley, who is 13 today. Happy birthday, Ace.
Oh.
And Lainey, who is 10. And I grew up in Mobile, Alabama.
Okay.
Went to South Alabama for med school, and then came up to Vanderbilt in the early 2000s to do a medical training. And met my wife. Started building a career and put down roots here. Fell in love with Tennessee and her people, and had a chance to work at Meharry Medical College. I was on faculty there for almost 8 years. It's the oldest historically black medical college in the country, and served at Nashville General Hospital, and most recently have been working up in Sumner County.
All right, so you've got 3 teenage girls, or almost teenage girls. Wow.
Right. That's right. We've got a full plate. Which kind of begs the question, right? Like, why would someone a family with 2 busy careers and full plate with the kids at the house, try to jump into politics? And it's just because we care about Tennessee and we know we can do better.
You must really, really be inspired to take this on. I'm very impressed. So, were you always a Democrat, or did you become one later in life?
So I grew up in a very, conservative household, to be honest with you.
Uh-huh.
But I think, no one is born a Republican, no one's born a Democrat. I think your political views are shaped by your experiences. And, as I grew up and, went to college and, worked in the public health infrastructure, I learned what was important to me. And that's, I think that government is here to help us solve big problems. And that's why I align with democratic values. That's why I'm out there fighting for to be a strong Democrat and fight for strong democratic causes, which include, healthcare that doesn't break the bank, education that's equitable and quality and prepares our kids for the future, and a job market that, allows people to go out and have a job that'll pay the bills and so they can support their families.
Mm-hmm. With 3 kids in school, I'm sure y'all are very in touch with what schools, what our schools need and everything, huh?
So I think, the lack of leadership with COVID brought me to the table, but the lack of leadership, it's pervasive in other aspects of life in Tennessee, education chief among them. And, I know last week Governor Lee made an announcement that he wants to revise the BEP, which is the formula that the state uses to fund public schools. Welcome to the party, Governor Lee. This is something that we've been talking about in our campaign since we launched, because we know that public education is at the heart of a thriving economy. And so, we're 47th in the nation when it comes to funding our public schools. We're 11,000 teacher positions underfunded right out of the gate every year, and that expense falls to local communities to try to pick up the pieces and make it work, which is fine if you live in a wealthy community, but if you live in a community of that's less privileged, that's got less economic development, that's a big hit for folks. And so we want to level the playing field. We want to invest in our education system so that the folks in rural Tennessee have the same access to quality education that the folks in the more urban areas do, and we're going to go out and fight for it.
I hear you. I think it's so unfair that it's all determined by pretty much the property taxes. So, if you're in a rich area, you're going to have great schools, and if you live in a poor area, you won't. That's
right. And our kids deserve better. Our teachers deserve better. And the thing is, if we all want to go out and be able to have a job and be able to support ourselves. To do that, you need skills. You need it, and so we're going to invest not only in strong K through 12 programs, but we want to invest in workforce development programs that allow us to have kids that want to develop a trade to have that option, so they don't have to do 2 or 4 year college to be successful if it's not right for them.
Mm-hmm. Well, one thing I will say about Haslam is he did, set up the Tennessee Promise program so that students can go to, either a trade school or community college for free, and so I really respect that. And it's funny because universal free college is such a Bernie Sanders socialist type thing that I'm surprised that it came from a Republican governor. But he just saw what was needed. He knew that the free market wasn't going to fix that. He knew that people needed a little step up. And once those people get their step up, they will become independent, tax-paying, self-sufficient people, but they just need a little step up to get there, and I'm proud of him for having done that. I'm sorry, I think I interrupted you. What were you saying?
No, you're going to have a little bit of a spotty connection, but yeah, I just, I echo what you say. I mean, the day of kind of, pragmatism, practicality in politics seems to have passed us by. I think the folks in there now are more interested in scoring political points than they are of taking care of people. And, I really want to get back to that sense of like what is right for the folks in Tennessee.
Mm-hmm. So it sounds like are you driving right now?
I am driving. I'm headed down to Rutherford County this morning.
Okay, and then you'll be in Franklin. Okay, well, I'm so glad you could take the time to be with us. Well, I think you pretty much already answered the question about what made you decide to run. You just saw the mismanagement with COVID, right? Sorry.
That's right. I mean, we had to, even at the little hospitals that I work in, we had to say goodbye to hundreds and hundreds of patients. And I think, there was one story that was a real call to action for me. One case, and it was when we had to call this young girl, a 14-year-old girl, the same age as my oldest daughter, Lily. And she was the only English speaker in her household. And we had to call this poor child in the middle of the night and tell her that her daddy had died. And that broke me.
Yeah.
That was a life-changing experience. And, I came home that night and, I couldn't sleep, and I'm crying into my cell phone, kind of making myself a video journal because I wanted to remember that moment. I wanted it to be fuel. I want to give that child a voice. I want to give her daddy a voice. I want to give the people who lost their businesses a voice. I want to give the kids who are sitting at home, unable to go to school because of reckless policies from the governor, a voice. And I realized that the same lack of leadership that had gotten us into trouble with COVID was wrecking us in so many other aspects of life here in Tennessee. So we're going to stand up and tell the truth.
All right, so I'm going to ask you, if you had been the governor at the very outset of the COVID crisis, what would have been your policies? What would you have done differently than what he did?
Right. So I think in the beginning it was reasonable to have a stay-at-home, policy until we figured out about how the disease is transmitted. When we think back to the very beginning, we really didn't have any treatments for this that were proven. We didn't know what we were dealing with. And so I think, trying to mitigate the spread of the virus in our community would have been helpful early on. And I think, Nashville, our local government, they got it right, kind of striking the middle ground about how to approach it. Other local governments throughout the state got it right as well. The governor just refused to lead on this point. And I think most recently, with respect to public schools, a temporary mask requirement to protect the health and safety of our children, the majority of whom are unvaccinated because they're not eligible yet,
right.
to protect our teachers would have been the right thing to do. Absolutely.
Mm-hmm. So, yeah, because I thought shutting down schools was a terrible idea because I just don't think there could be anything worse for kids than learning online and sitting at home all day. I mean, I hated that. And, so that's one extreme. The other extreme is go to school with no masks, no distancing, no blah, blah, blah. It seemed like there would have been a great middle ground, which is let's all go to school, but let's wear masks and spend as much time outside as possible with the windows open. And that's what they did at Swanee Elementary. They said, okay, we're having school, but everybody's got to wear masks. But then, Bill, and it's funny because Republicans say they're all about local control, but they are stopping local governments from doing what they think is best. They're trying to stop any kind of a mask mandate. And I'm fine with okay, don't wear it when you're outside, but when everyone is inside in a room when it's cold outside, so the windows are closed, then just wear it. And that just seems like a great middle ground between everyone staying at home or just everyone being there and getting everybody sick,
Yeah, that's exactly right. I mean, the whole reason that the schools were having to act was because the school districts locally were having to act was because there was no plan from the governor to deal with this situation. And so what does the governor do when school boards are acting out of desperation to protect their teachers and students? He uses his emergency executive authority to undercut local authority to lessen our response to a pandemic. And kids are getting sick, and teachers have died, and I think it's in part because of these decisions. And look, nothing ruins an argument like data. So if you want to see if masks work in schools, look at the data generated over the last couple of months right here in Tennessee. In counties where the opt-out was not permitted, and by the way, it's been struck down by a couple of federal judges, but in places where the opt-out was not permitted, Davidson, Knox, Shelby counties, the incidence of COVID in school-age children in the schools has been half what it's been in the other counties. So, I don't like wearing masks and I don't like mandates. But
I hate them. I hate masks.
Care of each other.
Yeah, I have to wear one at work, and not when I'm in my office by myself, but the rest of the time. And yeah, I hate it. I hate it more than anything on earth. I have to teach wearing one, and it is awful. It is awful. And God, I just want this to end so that we can quit doing this. And if people just won't get vaccinated, and they're filling up the hospitals. A friend of ours, and I'm not going to say his name because, medical privacy and all, but he got in a terrible biking accident, broke a bunch of bones. They airlifted him to the hospital, and there were not enough beds for this man. And it just makes me so mad that the hospitals are filled up with people who wouldn't trust their doctor enough to get a vaccine, but then they're trusting the hospitals to help them, and people who did get vaccinated can't get into the hospital because they're taking up all the beds, and that makes me very angry. Anyway, so what do you see as like the ideal balance between lockdown on one extreme, or like no school, and just doing nothing like Bill Lee is? What do you see as the right balance? Because nobody wants lockdowns,
Yeah, I had a little trouble hearing the question, but I think you were asking me what's the balance between lockdowns and doing nothing, basically. Mm-hmm. And I think the balance, if that's the question, is to give people information, and with information, people can make decisions about how to act in their environment. So I think allowing local school districts to make decisions to protect their children is totally reasonable. I think allowing local governments to make decisions to protect their kids is totally reasonable. Early on, I think it would have been better to have a more broad approach, because we didn't know how this was spread. We didn't fully understand all the consequences of the economic disaster that was headed our way. And I think that the governor was kind of slow to respond, and that's part of the reason that we ended up being like number one in the world in per capita new cases for a long time. Mm-hmm. So I think that we need to be wearing masks when we're indoors in close proximity to other people. We need to be telling the truth about the vaccine, because the vaccine is the only way out of this. That's just the way it is. Like the vaccine is the way we prevent this virus from being transmitted in our community.
Mm-hmm. How much do you think Tennessee has lost in terms of life and money because of COVID? Like how many businesses closed or people died because of this?
So as of a couple of months ago, in the sort of the depths of things, in July, like 40% of the small businesses in Tennessee had been adversely affected or closed. I mean, like that's a really big economic impact, as you can only imagine. Kids were out of schools for hundreds of days. I mean, the education loss was dramatic. And I agree with you. We could have done school safely if we had some common sense in government. 14,000 of our fellow Tennesseans have died because of COVID-19. That's an incredible amount of loss.
I think in Franklin County we're right at 99 people.
Yeah, I mean, it's and that number is hard to understand when you just say it, but that's 14,000 empty chairs at dinner tables around the state. Like that poor child we had to call 14,000 times. Someone has had to wail into that telephone or watch their loved one quit breathing over an iPad. I mean, I can't explain to you the depth of the misery that people are living every single day. Mm-hmm. And I just want it to be better. I know we can do better.
Mm-hmm. Now, I know Tennessee did get some things right. Our county health department did and is doing an amazing job. I mean, right at the beginning, they set up an outdoor drive-through testing site. You can come and get your vaccines there. You can get testing there for free. They have done an amazing job from day one. I know that I believe I remember hearing on the news not too long ago that the head of the health department was fired or had to step down or something. Do you know anything about that?
So are you talking about...
it was a woman?
Dr. Fiscus?
Yes.
Yeah.
So she's the head of the Tennessee Health Department?
She was the chief vaccine officer.
Oh, okay.
Yeah.
But overall, though, I was so impressed with the way our Franklin County Health Department stepped up. I don't know if that was replicated in every other county, but I know the Grundy County Health Department did too. And, we were so impressed by them. I mean, the Franklin County Democratic Party went and brought them out a pizza party and flowers one day just to show how thankful we are, because they were out in all kinds of weather, giving people these tests.
And look, I want to make sure that I'm making a distinction between the politicians driving the process and our dedicated state workers who are out there every day making the wheels turn and trying to keep us safe. I mean, they have, worked their tails off for a year and a half to make sure that vaccine is available and distributed. The problem is the people at the top who drive the messaging, those guys have been unwilling to tell the truth, and they've actually made it more difficult for our health departments to function the way they're supposed to. I mean, the supermajority in the legislature threatened to defund the Department of Health because they didn't like, the fact that they were doing vaccine outreach to children, using a policy that was decades old to do that. I mean, this was long-standing vaccine policy in the state of Tennessee, and that's why Fiscus got fired. Dr. Fiscus got fired because she recapitulated, just sent out a memo stating long-standing policy regarding vaccines in minors, and for that, she got fired over pure politics. And actually, not only did they threaten to defund the Department of Health, but all vaccine outreach, not just COVID, but all vaccine outreach was suspended for a period of weeks. This is at a time when we're already 30,000 MMR vaccines behind from the year before with our kids because of, all the disruptions from COVID. So they just have no problem putting politics over people. They have no problem putting your health, your economy, your safety at risk to score a political point. And that's the distinction I want to make.
Wow. We are going to have probably an outbreak of measles, mumps, and rubella coming up soon. Good Lord. And I don't understand these people who are so against this COVID vaccine. I'll bet you they all got their kids polio and measles, mumps, and rubella and didn't even for 1 second ask what's in it. I mean, I know when all three of my kids, we went and got every vaccine that the doctor said to get, and so does everyone I know. And now all of a sudden people have to know what's in it. I heard something on the news that there was a doctor who did outreach to heroin addicts. So these are people who shoot poisonous drugs into their bodies every day, but they wouldn't get the vaccine because they didn't know what was in it. Do you know what's in your heroin or where that came from? I cannot understand why this vaccine is so different from every other vaccine that people take without any question.
It's a shame that it's become so political. And right now, everybody's just on teams, right, and not thinking about the science behind it. And so what I really want to do is to try to kind of de-escalate the rhetoric and focus on giving people good information because, really we're dealing with two pandemics right now. We've got the pandemic of the virus, and then we've got the pandemic of misinformation. And I think if we can have a reliable voice in the governor's office speaking the truth, speaking out against folks when they say it's gene therapy or that the vaccine modifies your DNA, or if we have someone speaking out against that misinformation, that we can make a difference.
Mm-hmm. Now Bill Lee did get vaccinated, right?
That's my understanding. And I wish and in my opinion, that was a missed opportunity for him to do it sort of privately. I mean, I think, like that, there's a chance for you to say, look, I'm going to be on television, I'm going to be in front of the media, and I'm going to get this vaccine to lead by example and to show you that I believe in it. But he missed that opportunity.
Yeah, that's the other thing that kills me is everyone on Fox News has been vaccinated, every one of them, because you can't work there without one. And then there they are on the news spreading misinformation about it every day.
Yeah.
Even our state senator, Janice Bowling, she held a meeting with doctors who promote bizarre cures and deny, vaccine deniers. She gave them a platform and hosted them at a meeting. So, I mean, this is the kind of leadership we have right now. It's scary.
Yeah, that is actually not leadership, and it's deception, and it costs people lives.
Yeah, when you legitimize these people by hosting meetings for them, you're just spreading more misinformation.
That's right. And look, we would love for all of these things that those folks are talking about to work, but they just don't. And for her or anyone, for the senator or anyone to be out there, touting these things as therapies, it just hurts people, and it's not the right thing. I think that respectfully, politicians should do what they do and let doctors and scientists do what they do to help get us through this.
Mm-hmm. So what is the best treatment? Monoclonal? I can't even pronounce it.
Yeah.
So tell us, what are the good treatments and what are the unproven ones?
Sure. So the things that we know work, first of all, the vaccine and kind of preventative measures like wearing masks, staying socially distanced, that sort of thing. If you test positive and you're in a high-risk category, and those categories can be found on the web, it includes things like advanced age, immunosuppression, those sort of things, then you could be a candidate for a monoclonal antibody treatment. And a monoclonal antibody treatment is basically an infusion of antibodies that go in and try to scoop up the virus and grab it before it has a chance to set up shop in you and cause a lot of damage. And that is effective therapy. Once you get to the point of having low oxygen or being really ill, that therapy is no longer good. Then you get into my world where you come into the hospital. And then in the hospital, we have a variety of therapies that we use. We use a steroid called dexamethasone, which has a mortality benefit associated with it. In other words, fewer people die when they get dexamethasone. We use remdesivir, which is an antiviral medication that stops the virus from replicating inside of you. We use anti-inflammatory medicines called tocilizumab or baricitinib in certain cases. And there are other supportive strategies that we use. But those are the mainstays of COVID-19 inpatient management.
And so what are the ones that are not proven to work that people are talking about?
So, the one that we hear about the most is ivermectin. And ivermectin has medical indications outside of COVID-19. I think my wife's a dermatologist, and she tells me that it's used for scabies, it's used for some skin conditions, it's used for certain parasitic infections. It's primarily used in the veterinary world, however, as a deworming agent. It is not indicated for COVID-19. It's been looked at in a number of different studies. There's no evidence in high-quality studies that ivermectin has any benefit at all in COVID-19. And look, I would love for it to work, but it just doesn't. And in fact, calls to toxicology centers across the country because people are using this medication without guidance. Mm-hmm. And they're going to local co-ops and buying it for, and trying to take a few clicks for themselves. And that's harmful. And, the FDA sent out a message to physicians saying this is not indicated for COVID-19 and shouldn't be prescribed for it. So hopefully people are following the recommendations. Hydroxychloroquine or Plaquenil does not work for COVID-19. That was real hot earlier on, in the pandemic. Everybody wanted to be on hydroxychloroquine. That drug was studied extensively in multiple different formats, pre-exposure, post-exposure, in the hospital. It just doesn't work. Mm-hmm. And so those are the two hot ones.
So I guess if you took something effective like remdesivir, but then you also took something that's not proven and then you were cured, you could then credit it to the unproven thing maybe. I don't know.
Right. That's right. And that's the reason you need what's called a randomized controlled trial
Right.
to study these medications, because it allows you to isolate, hopefully, which variable is causing the benefit.
Right. Okay, let's just switch topic away from COVID-19 because I am so sick of that topic. What is your policy on Medicaid expansion? So a lot of states, Virginia, Kentucky, Arkansas, states that are right around us have expanded Medicaid as part of the, Obamacare, They have done it, but Tennessee has stubbornly refused to expand Medicaid so that people with low-paying jobs who make too much for regular Medicaid but don't earn enough for the Obamacare exchanges fall in a gap, and they're basically being punished for being a low-wage worker. Would you expand Medicaid to fill in that gap between traditional Medicaid and private insurance?
Absolutely, I would. We need to expand Medicaid yesterday. Here in the state of Tennessee, we are giving up $1 billion a year, almost $10 billion since the program started, that we could have been using it to invest in healthcare infrastructure in this state and to invest in our people. And you're exactly right. Medicaid expansion is not a handout. Medicaid expansion is affordable healthcare insurance for hardworking Tennesseans, for our hourly wage workers who are out there trying to make ends meet, and for whom healthcare insurance may be the last bill they get to every month. We want to give them an affordable option. We've had 14 hospitals closed in this state since 2012, primarily out in rural Tennessee. So who's bearing the brunt? Who's bearing the brunt of the legislatures and the governor's inaction? It's the folks who live out in rural Tennessee. So we're going to go out and tell that story. 1 in 5 of our counties here in Tennessee doesn't even have an emergency room. And so, if you want people to go out and work hard, you need a couple of things. You need a well-trained workforce, but you also need a healthy workforce. And that's why we are going to fight hard to bring Medicaid expansion to the state of Tennessee, and we're going to do it the day after I'm elected governor. I can't wait to do it.
How have you seen any sort of data comparing Kentucky, Virginia, and Arkansas, the places where they did expand Medicaid, and Tennessee where they haven't? Like, have health outcomes improved in those states?
So access to health care improves. Medical bankruptcies also fall. Unfortunately, that's another metric where we lead the way, and we're number one when it comes to medical bankruptcies in the state of Tennessee. So, yeah, it's been looked at, and outcomes do improve, when you have more money in the system to take care of folks.
Mm-hmm. Yeah, I mean, the people that I feel so much for, that I respect so much, are people out there doing low-wage but necessary work. And to think that our leaders in Tennessee think that they don't deserve health insurance. Whereas someone who sits at home all day and does nothing, they get Medicare. People with really nice jobs or more cushy jobs, they get health insurance through their work. But it's these people working in restaurants and grocery stores and doing very necessary work. They are getting the shaft from Tennessee Republicans. And unfortunately, those very same people are voting for Republicans who I don't understand it.
You're right. Not only is it kind of like you're saying, you're making a moral argument. I agree with you. It's morally the right thing to do to take care of folks. It's also like, if you just want to be, if you want to preach to purely someone's selfish desires, it's in all of our best economic interests to have a healthy workforce. To take care of each other. So, I think there's an argument for everybody out there about why we should be expanding Medicaid, taking care of our Tennesseans, and doing better for one another.
I totally agree. I mean, look at what's going on now. All these shipping interruptions, it's because they don't have a healthy workforce driving trucks and operating ports and things like that. People are calling out sick. The slaughterhouse had to close for a week because of people getting sick. I mean, we need a healthy workforce. I totally agree. We're fixing to close out here, but before we go, I wanted to ask you, what is your definition of being pro-life? The very limited definition of being pro-life is being against abortion. But what is your definition? Because to me, it means doing things that support life, like healthcare. But so what is your definition of being pro-life?
Yeah, so I'll just tell you that I don't think that the government has any role in a doctor's office with a woman, her physician, her family, and her God. And so, that's where I stand on the abortion issue. I can tell you that, if we are going to stand up and be, pro-life, we need to fight for people who, don't have access to health care. We need to fight for people who are unhoused. We need to fight for the least among us. And so, that's why I'm going to go out and run on strong democratic principles, which I think are also Tennessee principles. And that's health care that's affordable and doesn't break the bank, an education that allows people a chance to get ahead, and an economy that works for everybody, regardless of the color of your skin or the zip code you live in.
And we need clean water and air. We cannot have life without that, right?
That's exactly right. That's one of the things that makes Tennessee special is our natural resources, and we need to protect them.
If anyone has any questions for Dr. Martin, please call in at 967-2201. All right, well, before we go, if no one calls, what other issues are important to you in this race?
So, one thing I want to mention is that, there's a huge economic investment that's going on right now in West Tennessee with the Ford factory coming to town, and, they're going to have a big green energy initiative out there. I want to make sure that not only are we talking about the investment that the company's making, but the investment that we're going to make in our workers. And so we're going to be supporting organized labor in my administration, because we know that organized labor is how you get stable wages. It's how you get a retirement with dignity. It's how you get a safe work environment. And so we're going to definitely keep that at the top of our agenda.
And so this Ford plant is going to make all electric Ford trucks?
So I think that's right, and I think they're going to be making like the lithium battery cells for their electric vehicle platforms. So it's great. I mean, like, we are a green energy leader, and I think we need to be touting that as much as we're talking about making cars. We need to be talking about the fact that we're a green energy leader. We've got the Nissan plant in Smyrna. We're making electric vehicles now down in Spring Hill. We've got this huge investment by Ford in West Tennessee. So we need to leverage our advantage here with green energy and start making the shift right here in Tennessee.
My niece is coming to visit me this weekend, and she just bought an electric car, and she's driving all the way from Baton Rouge to here, and she's mapped out all the charging stations, so this will be her first long trip with it. I wish I could have one, but we have to park too far from the house, so I don't have a cord that would reach that long. Otherwise, I would get one. All right. Well, thank you so much. I know you've got a lot to get to today, and I appreciate you taking the time to talk with us.
I really appreciate the chance to talk, and look forward to the next time, and we'll see you all this afternoon.
Okie doke. Thank you. Bye-bye.
Bye-bye.
Hit the speaker button at the bottom.
Oh. Okay. All right. Well, if there aren't any more callers, I guess we're going to call it a day here. And thank you so much for tuning in. So just remember, our next meeting, the Franklin County Democratic Party's next meeting is on October 21st at the Annex at 6 o'clock. That's a Thursday. If you can make it today at 1:30 and to meet this lovely young man we just met, he's going to be at the Annex at 1:30, and that's about it. Thank you so much, Al.
You're welcome, and you have a good day.
All right.
It's 8:49.
He ain't got my smile, that don't bother me.